Sergey, who's an atheist, him from Canada, wanting to talk about physician-assisted suicide. So, kind of
Yes.
content warning for people in the audience. Um, this might get a little bit heavy, just a
Yeah.
heads up. Sergey, what would you like to talk about? Do you have a specific question related to this?
Yeah, and it's not going to be that heavy, Ben. I don't know if you're familiar with the Canadian healthcare, but here in
Mhm.
Canada in 2016, they've implemented M.A.I.D, medical assistant in death.
Hmm.
And so doctors have started offering assisted suicide unprompted. So the patient didn't ask, but the doctor said, well, we can't help you. How would you like to die instead? I'm
Do
sorry.
you know if
But that's it.
do you know if that's the way that they've been phrasing it, or is that your guess?
No, this was actually stated in an article I read on Tuesday.
Because I have questions.
Well,
So number one, is this one specific person that said it in that way? Because I honestly don't believe that that's the majority of people that would be having the conversation in that manner. Um, Reason being, we have conversations frequently with people about their goals of care, right? So we talk about end of life. We talk about, like, do they desire full recovery? Do they desire comfort? Do they desire CPR? Do they desire a tube? All of these things we have conversations with unprompted all of the time because we need to know. You just never know when something is going to happen. And especially with very terminal patients, you need to have a goals of care discussion with them. And it's a very difficult conversation to have, to say, hey, this is the reality of your medical condition. Here are your options. And so my guess is that the majority of doctors that are offering this unprompted are phrasing it as a, here are your options, and not just saying, you're terminal, how do you want to, like,
Right.
do you want to assisted suicide? Like, that's, I'm sure, I'm not saying that none of them are doing that. I'm sure that there are physicians with poor bedside manner that inappropriately phrase the conversation, and that maybe needs to be looked at on an individual basis and making sure people have communication training on that. But I'm hesitant to say that that is the norm. And I would say it is important to have these conversations, even if they are
Yes.
unprompted, as part of the goals of care discussion.
And so it also looks like MAID is actually the repeal of blockers from receiving medical assisted death. So it looks like from what I'm finding here, because I've actually researched this topic before and I used Canada as an example. It looks like in the past there were laws blocking you from being able to get any sort of medical assistance in death. It was illegal for them to allow you basically assisted suicide. And now it's
yeah.
the repeal versus Carter versus Canada of those blockers. So it's not necessarily that your doctor can just tell you, we don't want to help you anymore. We're going to just put you out. It's more, there's nothing now blocking you from receiving that assisted death, given that you meet certain parameters and mental health checks.
Yes, you're absolutely right. And Ben, you also are absolutely right. But I have read news articles. The most recent one was from Tuesday, which is the reason why I'm calling. This question has been on my mind all week. There's a woman in Vancouver who was told, we're sorry you have stage 4 cancer, but our medical service in Canada cannot help you. Would you consider medically assisted suicide? She didn't ask for it. She knew there were other options, but that's what happened. And
Right. So again, this is a one-off thing. And number one, you're citing a news article,
that with
which is probably,
friends.
like, we know that the news doesn't always correctly communicate what went down in the original encounter. And secondly, like, if this was the case that actually happened, like, sure, I would say, hey, that maybe that doctor needs some communication training and needs to think about how they phrased the conversation and how they had the goals of care discussion, which I'm all in favor of extra training, because
Right.
it's a hard conversation to have. It's a very, very difficult space to be in with somebody. And so, sure, I think it's totally reasonable that somebody had a poor interaction, but I don't think necessarily that's reflective of the entire medical community surrounding
Right.
this. And I don't necessarily think that one news article is accurately communicating the
Right.
information. I would need more information from this encounter to make a judgment on whether or not this doctor's actions were
Right.
appropriate.
And I think in that instance too, one, getting multiple opinions from multiple doctors would be important. And two, if they had euthanized her without her permission, that would still be illegal, I'm sure.
Like that would be a problem. But
Yeah.
having the conversation without your
Yeah.
consent is not a problem because you need to have the conversation because like this is the core of informed consent.
Mm.
Like if you give somebody options and you don't give them all of the alternative options, you are not allowing them to make appropriate informed consent, and you can be held liable for that. Because if
Right.
somebody wanted an option, like or would have wanted an option that they didn't know about, and you didn't tell them, and they picked a different option, like and they came back and said, actually, I would have wanted this thing, but instead I went down this route and gave me these complications that I wouldn't have wanted. That's still falling back on you. So
Right.
even if someone doesn't want to have that conversation necessarily, we have to have the goals of care conversation, and we have to give them all of the options.
Right. In the question of the source, I've actually went through about 6 different articles from 6 different newspapers, all very similar in context. She went to the doctor. The doctor said, "We're sorry, we can't help you. Would you consider it?" And she went to the news about it later on, and this has been going on since March of this year. The
So I
article
guess
from this Tuesday was updated.
so my question, I guess, is just so I can understand, is the problem that they offered her that option, or is the problem that she doesn't feel like they offered her enough options?
Both.
Okay. So at the point where maybe they feel they have done everything they can possibly do and there's nothing else they can do to help her, would you say that it's a problem they give her that option? Like, for example, if I were in her shoes and I knew that my options were bleak, that no matter what there was going to be a lot of suffering and a lot of pain, I would want to know that at least the option when my pain has gotten to the point where I no longer want to live with it, that the doctors will help me end my life. I don't think that that's a bad thing to offer her. It might be a bad thing to offer someone without telling them that there are alternative options for healing, but it sounds like her options were extending her pain and suffering or giving her the ability to decide when that pain and suffering ends. If I'm understanding correctly, it sounds like she was terminal regardless, like she's terminal. And they can either continue to do operations and procedures and transfusions and things that aren't going to fix it. They're just going to prolong the situation. Or they ask her, would you rather set your date? It doesn't sound like anybody was trying to
Okay.
poison her, is what I'm saying.
Yeah.
Yeah, well, you've hit the nail on the head with that. She did, in fact, fly to Baltimore and spent $200,000 on treatments, which ones I don't recall. I'm not a medical professional.
Mm.
But she has spent the time, the money to go there and come back, and has spent 200,000 plus in Canadian. So and so far there has been no updates on her state of being,
Okay.
mental or physical.
Yeah, and I mean,
personally, I'm for it.
Mm.
But I would like to ask a professional question of professionals such as yourself, Dr. Ben.
Yeah, I mean, and it's a sticky situation. It's a hard one. Like, no one wants to have the conversation of, do you want hospice or do you want like physician assisted suicide? And that's like, unfortunately, a question that people have to face. And some people might want neither, and they might still try to spend money for treatments that are essentially futile. And that's their business. But I think, like, without context, I don't know much more of the situation of whether or not this particular doctor was inappropriate. He may well have been. They may well not have been, and I just don't know.
Yeah.
But I think maybe there's a lot of information here that is just
Right.
unknown at this point, so I can't really make a determination. So
Yeah.
I hope this at least helped a little bit in the discussion. But I think we're gonna wrap up this call here. Unless you have any other thoughts.
Okay, yeah, well, No. I appreciate your time and I appreciate your input. And a quick shout out for last Sunday's Tom and Jimmy Jr. They are fantastic conversationalists. And thank you for the book. You
Yeah.
Think You're Dead, or I believe it's called.
Yeah, thank you for calling in, and
Yeah.
thank you for watching and appreciating the show. I'll pass on the kind words to the host of last week. They would love to hear about that.